Body image is defined as the mental picture you have of your own body. It is how you see yourself and how you feel about your body. The way we perceive our bodies is not always the same as how others view our body. Sometimes our perception is inaccurate because it can be distorted by our moods, emotions, experiences, and other outside forces. Body image can be affected by many sources. The media has a powerful impact on the way we see ourselves. Every day we are bombarded by images that tell us how we should look, dress, or behave. These airbrushed, perfected people we see can send the subliminal message that our body isn't good enough or doesn't measure up to the societal standards of beauty. Some modern advertising campaigns are seeking to combat this widespread media message by showcasing more realistic images of men and women. It is important to train yourself to be a critical consumer of media images. When you can discern which images are photoshopped and airbrushed, and which more accurately portray the imperfect human form, it is easier to be more accepting of your own imperfect body and love it for all the amazing things it can do. The people with whom we surround ourselves can also have a large influence on our body image. Family, friends, teachers, coaches, and others can affect body image with their words and actions. Sometimes these words and actions are supportive and help to foster a positive body image. Other times, abusive language or thoughtless actions can damage body image and self-esteem. Some adults also model poor body image by making negative comments about their own bodies. Especially during the teen years, there are lots of changes occurring as the body goes through puberty. Sometimes these changes can occur so rapidly that it might be difficult to mentally adjust. Also, everyone is different and goes through the changes of puberty at different ages and paces. Then it can be difficult not to compare yourself to your peers. All these factors can affect body image positively or negatively depending on the individual. Finally, your own thoughts or cognition and the way you speak to yourself can greatly impact your body image. Self-talk includes all the ideas and thoughts you say to yourself. Self-talk can be said out loud or just in your head. Self-talk can be positive or negative and can make you feel like your own best friend or your own worst enemy. These are some major factors that affect body image, but of course other factors could also come into play. When it comes to body image, everyone has things they like about their body and other things they dislike or might like to change about their body. Hopefully, there are more things you like about your body than you dislike. This is called a positive body image. A negative body image results when we are too critical of our body and focus too much on our imperfections and not enough on our strengths. A negative body image can lead to depression and, in some cases, risky or harmful behaviors. Sometimes these risky or harmful behaviors might include using tobacco, alcohol, or drugs to escape feelings of low self-worth. In other cases, the harmful behaviors may include unhealthy disturbances to eating habits, known as eating disorders. Eating disorders are serious mental illnesses that involve an obsession with food, body weight, and body shape. Following are some of the more well-known eating disorders. Anorexia nervosa involves self-starvation and an inability to maintain a healthy body weight. People who suffer from anorexia see themselves as overweight, despite the fact that they starve themselves to the point of being severely underweight. This intensely distorted body image drives people with anorexia to weigh themselves constantly and to restrict the amounts and types of food they eat because they are so fearful of gaining weight. Other symptoms of anorexia may include brittle hair and nails, dry and yellowish skin, and the growth of a fine hair all over the body called lanugo. Anorexia can cause women to stop having their menstrual period. Over time, anorexia can cause damage to the heart and brain, multiple organ failure, and even death. In fact, more people die from anorexia than from any other mental disorder. Bulimia nervosa may be harder to identify because people with this disorder may be of normal weight. This eating disorder involves repeated episodes of uncontrolled binge eating, followed by behavior aimed at preventing weight gain. For example, self-induced vomiting, misuse of laxatives, fasting, or excessive exercise. People who suffer from bulimia may experience a chronic sore throat, swollen glands in the neck and jaw, and worn tooth enamel that results from habitual vomiting. They may also experience severe dehydration and an electrolyte imbalance that can lead to stroke or heart attack. Exercise bulimia, or compulsive exercising, is a disorder in which a person exercises at a level that cannot be supported by their nutritional intake. Individuals who struggle with this disorder are obsessed with exercising and do not eat enough food to sustain their energy output. They may prioritize exercising over other important activities and may become anxious, angry, or feel guilty if they miss a workout. The excessive exercise sometimes leads to injuries to the bones and joints, frequent illness, and constant fatigue. Individuals with exercise bulimia generally work out despite injury or illness. Women suffering from exercise bulimia may stop having a menstrual period. The last eating disorder we will discuss is called binge eating disorder or compulsive overeating. This is the most common eating disorder in the United States and is characterized by eating uncommonly large amounts of food within a specified time period. Individuals with binge eating disorder often feel a lack of control over their eating during the binge. Those with binge eating disorder do not purge after overeating, as those with bulimia do. They may, however, fast sporadically or diet repetitively as a means of losing weight or maintaining a certain body weight. Contrary to what you might think, not all people with binge eating disorder are overweight or obese. Body weight amongst people who struggle with compulsive overeating may vary from normal to slightly overweight to severely obese. Some people struggle with unhealthy eating habits that aren't quite as severe as one of the typical eating disorders we just described. So-called disordered eating may include a collection of abnormal eating habits, abnormal weight management practices, or warped attitudes about food, weight, and body shape. Even though disordered eating is not as severe as having an actual eating disorder, it can still lead to health issues for the individual in question and should be taken seriously. Treatment for serious eating disorders and instances of disordered eating must be tailored for the individual on a case-by-case basis. Treatment must address not only the symptoms and physical consequences of the eating disorder, but also the mental and emotional issues that are the source of the eating disorder. Therefore, treatment for an eating disorder includes a number of different healthcare providers that work as a team to address the individual patient's needs. This team might be composed of a psychologist, psychiatrist, social worker, nutritionist, primary care physician, and/or a network of support groups. The most severe, life-threatening cases may require hospitalization to provide immediate medical care, and later, long-term residential care that specializes in eating disorder treatment. Family-based treatment has been documented as being successful for families who have an adolescent struggling with an eating disorder. In family-based treatment, the adolescent is not required to stay in an inpatient facility, and parents, coached by the healthcare provider, play an active role in treatment. The most effective and long-lasting treatments for individuals with eating disorders involve some form of long-term monitoring with a mental health care provider, like a therapist or counselor. Some cases may also require medication to help the individual recover. Building a positive body image is very important for everyone, especially individuals suffering from an eating disorder. Encouraging the development of a positive body image in young people today may even help to prevent cases of eating disorders in the first place. So how do we overcome a negative body image and learn to ignore the critical voices that constantly put us down? Here is a list of things you can do to build a positive body image for yourself and also model good self-esteem and a positive body image for those around you. First, learn to pay attention to and appreciate the many amazing things that your body can do. Whether it's running, dancing, drawing, dreaming, or just laughing, Your body is capable of so many things. Learning to recognize the things you are good at and practicing them to improve even more will help you to fully appreciate your body. It is important to practice feeling grateful for all your body can do. Second, write a top 10 list of things you like about yourself. Some of these things might be physical traits, but many could be things unrelated to your appearance, such as personality strengths or special talents you have. Read your list often and add to it as you notice more positive things about yourself. Remind yourself that true beauty is not about how you look. Some of the most highly valued qualities have nothing to do with your appearance. Society places a lot of emphasis on intelligence, health, emotional strength, and achievement, none of which have anything to do with physical attractiveness. Focus on these positive traits in yourself and less on what you look like. Surround yourself with positive, supportive people who will build you up and appreciate you for who you naturally are. Avoid individuals who berate you or who are overly critical of your appearance. It is easier to love yourself when you can feel the love of a supportive network of friends and family. Wear clothes that are comfortable and make you feel good about your body. Do something nice for yourself, like making time for a nap, taking a bubble bath, or finding a peaceful place outside to relax. Taking time for yourself will help your body to feel appreciated. Become a critical consumer of the images portrayed by the media. Understand that the photos we see in magazines are often manipulated to appear perfect. The celebrities we see on TV have flaws, and just like everyone else, they probably have certain things they wish they could change about their bodies too. Shut down the negative self-talk that makes you feel like you are not good enough. Overpower negative thoughts with positive affirmations that make you feel good. Refer to your top 10 list for some good ideas for positive self-talk. Look at yourself as a whole person and not as a bunch of specific body parts. There may be things about your body you wish you could change. Everyone feels this way sometimes. It's important to identify which physical traits you can realistically change versus those you cannot change. Set goals for yourself to achieve the changes you would like to see. For example, if you would like to see more muscle tone, you might make an exercise plan to achieve that goal. Setting reasonable goals and achieving them is a great way to boost your self-confidence and make you feel more positively about your body. Honing in on physical traits you cannot change accomplishes nothing. Many people obsess over aspects of their appearance that others barely notice. Try to see yourself as others do, as a whole person with some flaws, but a lot of good traits too. Nobody is perfect, but by focusing on our positive traits and making realistic goals to fix those things we are able to change, we can perceive our bodies in a more positive light. Finally, use the time and energy that you might have spent worrying about your appearance to help others. Try doing volunteer work around your community, visit with an elderly neighbor, or help a friend in need. Reaching out to other people not only helps you feel better about yourself, it also makes the world a better place. Building a positive body image is not always easy, but these strategies can help. Most people struggle with their body image at some point in their life, especially during adolescence. By recognizing the factors that impact our body image, we can be more deliberate about avoiding negative influences. Since a negative body image can lead to depression and eating disorders, it is important to practice the strategies of building a positive body image. These strategies include appreciating what your body can do, writing a list of things you like about yourself, remembering that true beauty is not about how you look, surrounding yourself with positive, supportive people, wearing comfortable clothing that makes you feel good, doing nice things for yourself, becoming a critical consumer of media images, replacing negative self-talk with positive affirmations, viewing yourself as a whole person, and spending time helping others. Remember to focus on your strengths and be forgiving of the things you perceive as flaws. Set reasonable goals to improve those things that you have the power to change, and don't forget to celebrate your victories. Your body is an incredible machine that is capable of so much good. Be grateful for all the strengths and wonderful imperfections that make you an individual. Certainly, there is no one else on this planet that has the unique combination of traits that you possess. That means that you have the potential to impact this world in a way no one else can. Surely that is something to feel positive about.